Hi, my name is Dr. Wakely. I'm a GP specialising in dermatology. I've been a GP for the past 5-6 years working for the NHS. I also own The Beauty Doctor, which is a company specialising in cosmetic treatments and dermatology. So I'm here to talk about how to treat acne scars. The main thing is obviously to treat the acne so that even though you get rid of the scars, you minimise the amount of acne lesions that keep coming up so that you don't keep producing scars. The amount of scarring depends on the type of skin that you have. So if you have darker skin, the scars tend to be darker in colour, or what we call hyperpigmented. There are various different ways of treating acne scars, ranging from various creams which are over-the-counter or prescribed creams to more intensive treatment given by doctors. So the creams to lighten the darker scars are things like Retin A, vitamin C creams, or vitamin A based creams, which can help increase the healing of the skin and help the scar to heal. The newer the scar, the easier it heals and the quicker it heals. Then there are other creams such as kojic acid and hydroquinone. Kojic acid works very well because you don't get much irritation with that, and it doesn't react very much to the sun, but it also improves the healing of the skin and reduces the melanin containing cells so that you don't get the hyperpigmentation when the scar is healing. Also, so hydroquinone is a very mild steroid. It is safe to use, but it's not safe to use constantly. So you can use it for every day for periods of a maximum of 2 to 3 months, but then you need about a month or two break as a rest. With hydroquinone and the Retin A or vitamin A based creams, you can get some irritation with the sunlight, especially if you're darker skinned, and actually that can make the pigmentation worse. So you do need to use SPF, sun protection factor of at least 50 throughout the day. Even if you're not going out in the day, just the fact that you can see means that there's UV light, and therefore you need sun protection. If it does cause irritation, then you stop it until the irritation goes away, and then you can start it again. There's also something called a derma roller, which is a fairly new product, which is very small needles, so you don't really see the needles and you don't feel them, and you basically roll it along your skin. You can buy them from reputable websites. I would actually though recommend you go to a qualified practitioner who's trained in that, so that you can have it done properly. What that does, it works twofold. One, the very small needles helps open up the pores so that it improves the absorption of any of the products that I've mentioned above, so it makes them work better. And it also causes a microscopic inflammatory reaction to the skin, and it improves the healing process, improves collagen production, and improves the scar healing process. So you may need several treatments for the results to come through, because they won't work after just one treatment. The other things that work are gentle peels, fruit acid peels, or gentle alpha hydroxy acid peels such as glycolic acid, and they range in concentrations from 20%, 35% to 50%, and you can also leave them for longer to increase the strength. I would recommend that you start a very gentle acid peel because it depends on the type of skin that you have, what sort of reaction you get, so you don't want too much of a reaction to make the pigmentation worse, and then you can gradually increase the strength as you go on. Fairer skinned people can have something called a TCA peel, which is much stronger, where you do peel. The other peels you actually don't peel, you just go a bit red, if that. But the downtime for a TCA peel can be several days, up to a week, so it's less of a practical measure, but it can work. The other thing I forgot to mention is with the peels, or by itself, a very good cream is a blending bleaching cream by Skin Tech, and it's got kojic acid and Retin A in it, and therefore the kojic acid reduces the irritation of the Retin A, and that's very good as an anti-aging cream, and also to improve pigmentation and scarring. There are also more full-on methods of treating, such as lasers. There's different types of lasers. There's a CO2 laser and something called an ERYAG laser, that's ERYAG laser. They can work very well. The CO2 laser, there is quite a bit of downtime with that, but the ERYAG laser, there is less downtime. They both also come in what's called fractionated lasers, whereby only a small part of the skin surface is affected by the laser, and so there's much less downtime and less redness and less side effects. However, you can get side effects of increased hyperpigmentation with them, and obviously redness as well. Fractionated lasers work by causing a tiny area of inflammation, and then the normal skin around it starts to heal by itself, and therefore the scar tissue around it heals better. Afro-Caribbeans, because of the nature of their skin, they've got more pigment, so they're more likely to hyperpigment, and therefore they can really only use the fractionated type of lasers. You can also use pulse dye lasering as well. However, some of the side effects include allergic irritations, as I mentioned before, hyperpigmentation, but also hypopigmentation, which is abnormal, uneven lightening of the skin as well. So you do need to be careful and make sure you go to a reputable company. So those are just some of the ways that you can treat acne scars, and I hope that's been of some use.